counting down to the massive health care overhaul. Lawmakers have been fighting over the Affordable Care Act for years, and it's led to a lot of health care confusion. 16 WAPT's Tammy Eswick went to doctors to find out what they expect to happen.
With the October 1st deadline, Mississippi doctors are planning for how they think health care reforms will affect Mississippi patients.
How do you think the medication is affected in this?
There are certain name brand drugs. They're allowed patents for a certain extent, and then they become generic. They have certain advantages to them, but if you were to have a single payer system, it could be possible that you couldn't use certain name brand drugs.
I mean, you can write the best medication in the world, but if they can't afford it, it's like you didn't write anything.
Dr. Tim Quinn owns a family practice in Ridgeland. Dr. Sam Fillingain is a heart doctor in Flowood. Both say they expect an increase in patients, but they have different opinions on whether the new law will improve the system.
I do believe that there will be an increase in people going to the doctor. But at the end of the day, if we have to work later hours or skip lunch, which I already do, it can save lives. I think that it's going to be a positive thing for our community.
I perceive good doctors getting more discouraged. I perceive office visits in almost every quadrant being shortened.
But if people get health insurance, more people, then they'll go get the screening mammograms, they'll be diagnosed early, and lives will be saved.
Isn't it possible that they wouldn't have the heart attacks later if you could treat them earlier?
Well, let's just consider they got earlier treatment, but you weren't allowed access to this laboratory. Then I couldn't see anyway.
Two doctors' opinions about how the new law will affect you and your health. Tammy Eswick, 16 WAPT News.
We have a special health care reform section of our website. It can answer many of your questions, including, do you have to change doctors, or what if you can't afford it? That's on WAPT.